How does melatonin affect sundowning in dementia patients? Imagine the evening hours when your loved one with dementia begins to become more confused, agitated, or restless. This common challenge is called sundowning, and it can be tough for both caregivers and those living with dementia. To understand how melatonin might help, we need to look at what causes sundowning and how melatonin works in the body. Sundowning happens because of disruptions in the body's internal clock, known as the circadian rhythm. This internal clock controls sleep and wake cycles, and in dementia, especially Alzheimer's disease, this rhythm often becomes irregular. As a result, people may experience more confusion and agitation during the late afternoon and evening. The brain areas that regulate melatonin production, like the suprachiasmatic nucleus, can degenerate, leading to lower natural melatonin levels. Melatonin is a hormone naturally produced by the pineal gland in the brain. It helps regulate sleep by signaling to the body when it is time to rest. In people with dementia, especially as the disease progresses, melatonin levels tend to decrease, and their natural daily rhythm may become less distinct. This decline is thought to contribute to sleep problems and the worsening of sundowning behaviors. Research into using melatonin supplements to help with sundowning shows mixed results. Some studies suggest that taking melatonin over a period of more than 12 weeks might help improve overall sleep patterns and reduce some agitation or confusion during the evening. For example, doses typically range from 2 to 10 milligrams taken at night, and some caregivers report that their loved ones seem calmer and more settled. However, other reviews, including a detailed analysis from 2020, indicate that the evidence is not very strong. They found that melatonin might have only a modest or inconsistent effect on sleep and sundowning behaviors. This means that while some individuals may benefit, others might see little to no change. It is important to remember that sundowning is caused by many factors, not just melatonin levels. Environmental factors like exposure to natural light during the day, maintaining a regular routine, and creating a calming evening environment are also crucial. Melatonin should be considered as part of a comprehensive care plan, not a cure-all. Safety is another key point. Melatonin is generally safe for most people when used appropriately, but in older adults with dementia, there is a small risk of side effects such as increased drowsiness or falls. Because of this, it is essential to consult with a healthcare professional before starting melatonin. They can help determine the right dose and monitor for any potential issues. In summary, melatonin can play a role in helping regulate sleep and possibly easing some sundowning symptoms in dementia patients. Still, it is not a guaranteed solution. Its effectiveness varies from person to person, and it works best when combined with other supportive strategies. Always seek personalized medical advice to ensure safety and appropriateness. Understanding the complex nature of sundowning helps us support our loved ones better, focusing on safe, evidence-based approaches that respect each individual's needs.